25th of November 1997. That is when I was first employed as a public health technician 1. I worked in Kilifi for close to 5 years, up to 1999. I got a transfer. I moved to Eldoret. I worked in Eldoret at the Municipal Council for 3 years. That is somewhere July 1999 to 2001, whereby I went back to school to upgrade, to get a diploma in public health at Nakuru KMTC. So I had to take a study leave. Those days we used to get study leave without challenges. So I got a study leave, and I got my diploma in 2003 September, where I was also posted back to Kericho. I worked in Kericho from 2003 September up to March 2004. And then I went back to Uasin Gishu. Back to Uasin Gishu, I was working at the Department of Environmental, that whereby I was supervising the cleaners and anybody who was offering the cleaning services within the municipality. Those days it was not yet devolved, so it was the defunct function of the municipality. So I was in charge of the environment department at the municipality Aden. And then I went back to school again in 2010. That is 2010 to 2013. I was in Moi University for now my degree course in the same public health, environmental health sciences, where I graduated in the 2013 I mean. And then after that, I went back to over the service. By then, when I was leaving for the degree, the county had not been devolved. Now I joined when devolution had just started. I went back to the county, and I was placed to be in charge of a sub-county, which is the Turbo sub-county. I was in charge of Turbo sub-county from the year 2013 up to 2018, when I was also transferred, though in the same level, with an added advantage, though it was on an acting capacity, to Moiben sub-county as a sub-county public health, sub-county health coordinator. And then, at some point in 2010, the county CPHO retired, and now Moiben sub-county is now where the county headquarters. So automatically, I had to take over the function of the county PHO, though I took it brief for a short time. Then there was an advert, and there was a director for preventive promotive deputy who took over now as the preventive promotive director / the CPHO. So I've been holding the position of the sub-county public health office of the Moiben until today, when I'm seated here. I'm still an employee of Kericho County. Not Kericho County, sorry, Uasin Gishu County. Now coming back to something that I had stopped kidogo, I got married back in 1993. I am a mother of one, biological, but I'm a mother of many. I've been taking care of 6 orphans, and I'm also a foster mother to many other girls. Thank you.
I think that is the most comprehensive introduction that we have had from the nominees. And you have touched on many matters that we were to ask about you. Basically, your educational background, where you come from, your work experience, and of course, having gone through your CV, I've also realized that perhaps you have been even to China doing. There's a very beautiful certificate attached from China, and the other also certificate courses that you have done, mainly on matters of public health. I wish to commend you on that. Maybe I'll just ask you a few questions, maybe that you have not touched about before I open the floor. And honorable members, I want to make a suggestion that using our vetting tool, perhaps we dispense off with it very fast before we go to section 4 on matters to do with experience and demonstrating of knowledge on the subject matter. If you agree with me, if you permit me, we go that way. So, Edna, you know the position that you have been nominated to is a public office position. I just want to ask you, particularly on area of potential conflict of interest in future. By this, I mean in your place of work, whether there will be family members, parties, or anything else, and explain how you will address if there is any conflict, or if any conflict were to arise. Yeah, maybe you can address that first.
Through the chair, I don't think there will be any conflict of interest, because at the moment, I don't see, there's none.
Okay. Yeah. Thank you so much. The other thing that I'll ask you is, I have seen you are a member of you have public health. It's called How do we?
Association of Public Health Officers, yes. Kenya.
Exactly. Yeah. So now, being a member, I've seen that, and maybe the thing that I'll ask you: do you have any? Have you ever published any writings or books or articles before, previously?
Okay. Through the chair, I've not written any publications by myself, but I was among the team who were doing the bill for sanitation public health for Uasin Gishu. I was a member.
Oh, okay.
Yeah.
Thank you very much. On matters also to deal with charity work, pro bono donations to charity, maybe you can describe what you have done by way of charity work, if any, listing instances, and maybe also telling us whether you contributed any amount or the time that you dedicated, just if any.
The chair, yeah. On the issue of the charity works I've done, as I've mentioned, I'm taking care of some orphans. We do pay fees for them. We actually do everything for them, from fees, and then we take care of them, their clothing. We took in as foster parents, so we literally do everything for them. Secondly, I am a member of one of the churches around, and when there are these functions at church, like the fundraisers, at one point I offered to put the tiles in one church by myself and by the support of a few friends. Also, I participate often and many times in the fundraisers for the sick, and even to raise fees for other children. Thank you.
All right, thank you so much. Of course, you have talked about the public office that you hold, but maybe regarding political activities and affiliations. You are a member of any political party, or are you advancing any agenda of political party? Or have you ever had before? Not necessarily now. Thank you.
Okay, the chair, I don't hold any political party, but at some point, somewhere last year, I'd shown some interest, but I saw the political way was tough, so I shun away from the politics. Thank you.
Maybe for the benefit of these members, which political seat were you eyeing? And just for the benefit of these members.
Through the chair, I was eyeing for the MP seat, Chepkirui East.
Okay, thank you. Maybe the next question that I'll ask you is, of course I had not seen it anywhere, but allow me to ask you whether you have ever been dismissed or otherwise removed from office for contravention of the provision of Article 75 of the Constitution.
Through the chair, no.
All right. Have you ever been adversely associated with the practices that depict bias, favoritism, or nepotism in discharge of public duties?
Through the chair, no.
All right. You have submitted, I have seen your CV, and I know the honorable members also have gone through it, but you have indicated referees, the references. Yes. I hope you have indicated their current contacts, and maybe just to ask you whether you have any objection if the committee feels that they to clarify some information from the referee. Do we have any objection, or we are free to contact them?
No objection, sir. No
objection. Now, the other question that I'll ask you is that being a government officer, or maybe before that, I have gone again through your CV and your certificates. Have you ever been awarded any honors or awards before?
The chair, I cannot say it was not in terms of any honors, but you talked of the China trip that it was through something that I had done, which was extraordinary from the other officers.
Mm-hmm.
Thank you.
Okay. So, honorable members, you can note that. Now, Edna Chepkirui Tonui, what is your net worth? Are you a hustler millionaire or?
Okay, I am a hustler. Chair, I am a hustler. My worth as at now should be 20 million.
Okay, and if you don't mind, you can just maybe just break the 20 million. We are not necessarily to the exact, but approximate figures.
Okay.
And maybe to ask is, I know being a government officer, you have also been declaring wealth before, is it?
Yeah,
maybe you can just, for the benefit of this committee, you can break your net worth of 20 million, please.
Okay, to start with, I own a shamba in Kedawa, around 5 acres. That one, if I estimate it, should be something like 3 to 4 million. I also own another plot in Kilifi, where I first started work. I also own a plot in Wasingishu, that's Eldoret, one which is vacant, another one is already built, and the others could be the household goods, because as for us women, the household goods which are there are always ours. Thank you.
Okay. Thank you very much. Have you ever been charged in a court of law in the last 3 years? If so, you specify?
No.
Now you have been working with the county government of Wasingishu. Have you ever been mentioned in an investigatory report by the county assembly of Wasingishu or any commission in the last 3 years?
No, Chair.
All right. Then I guess from there I want to invite my colleagues maybe to interact with you, and I will start with the Honorable Majority Leader who is here. You cannot.
Thank you very much.
Sorry, Honorable Majority. Nominee Edna, you can note the comments or the questions, and then you will respond when you are given an opportunity to.
Thank you very much, Chair. Welcome our nominee, and congratulations for making it to be the nominee for CEC Health. Now, I've seen your CV, and I see that you have a lot of experience in public health. Now, I would like to know what are the main challenges that are affecting the health sector. And if you are given an opportunity to be the head of health services in Kericho County, what interventions are you going to use to be able to provide solutions for the challenges that we have in the health sector? Thank you.
Chair. All right, thank you very much, Chairman. Congratulations, Edna, on being nominated to the CEC Health Services. Health is actually a devolved function. And the Department of Health is one of the revenue streams that leads in revenues in the county government of Kericho. But it has its own challenges. What plans do you have, if given an opportunity to be the CEC for Health, to enhance more revenue from all our sub-county hospitals, referral hospitals, and the entire Department of Health? Number two, looking at your CV, you are actually a product of the bottom-up approach, where you started with a certificate, diploma, then degree. You will be heading a department where the doctors will be answerable to you. And we know the chain of command sometimes, where doctors have got their own chain of command, the nurses have got their own chain of command, the public health officers have got their own chain of command. How will it be? How will you work with the doctors? Will it not have a problem where the doctors will be reporting to someone who is not a doctor? Because sometimes we may ignore that, but it ends up bringing a problem where it will affect services in our hospitals. Thank you.
Thank you, Chairman. My next question, Chairman, is that I want to congratulate the nominee for health services. Congratulations for getting that opportunity to appear before this appointment committee. My question is, going by your CV and what you've indicated, that you've been working in Wazingishu as a sub-county, probably sub-county public health officer, that is heading a sub-county hospital. Now that you've been entrusted this very critical docket by His Excellency the Governor, you will be canvassing this Kericho County. And don't you think that is an enormous job for you now that you are a sub-county public health officer? Secondly, you've indicated that you once aspired to be a member of parliament for Chepkirui East sub-county. But you realize later on that politics is a tough field. You shun politics. Now that you are now entering into politics of the entire county, you will be dealing with the governor. You will be dealing with 30 elected members of the county assembly. You will be dealing with another 17 nominated members of the county assembly. Somehow you will be interacting with the members of parliament, also because of health issues in where they represent. If you shun away politics, you never aspire to be an MP and you had interest, don't you think that now that you are entering into the county politics, will you be able to handle the heat of county politics. Thirdly, and finally, so that I don't speak, Chair, you are coming to a county where we have nearly 800 or more than 800 casual workers, that is on contract. We have around 800 on contract. What is your take? Will you confirm them? How, and if yes, when and where will you get the funds? Thirdly, is that drugs in our facilities are not there. We want to thank His Excellency the Governor the other day. I think he flagged out some drugs. But drugs has always been absent in most of our facilities. I know you know in where you come from, rarely do you find even an aspirin in a health center. What are you going to do to make sure that we have drugs 24 hours a day, 7 days a week, 352 weeks in a year? Thank you, Chair.
Thank you very much. I'm proposing, honorable members, that the Honorable Maritim and then Honorable Israel and then Rogon. From there, the nominee will respond to maybe the question. So, Honorable Rogon.
Thank you. First of all, is to congratulate you, Edna, for making it this far. I'm only going to ask you two questions. One, have you acquainted yourself with the budgetary allocation to health? Because from records, I'm told health is the department that takes the biggest allocation of our budget as a county. If that is the case, health is the worst, department in terms of service provision. Have you exposed yourself with some of the challenges facing that sector? And lastly, we have problems relating to, service delivery. When I talk about that, let me talk about the facilities in our various sub-counties. We have some health facilities that do not have a substantive, health work. It will shock you. I don't know what are the, strategies that you'll have in place to ensure all our facilities have officers who are hired by the county. Thank you.
Yes, the Honorable Maritim.
Thank you, Chair. Edna, welcome. I will ask you, as much as we are saying we are having shortage of drugs in our facilities, we also have shortage of staff. How will you handle that? Again, we have people who are working in health facilities who are volunteers. We call them community health volunteers. They are not getting any salary and they work hard and they are very important people. How will you handle them? Third, what measures will you take to avoid cases of workers downing the tools as strike in our facilities? Thank you.
Thank you very much, the Honorable Israel.
Thank you, Chairman. Congratulations, Edna, on your nomination to be appointed as CEC in charge of health. As we know that health is a very critical department in our county, and which has almost 34% of the allocation of the budget. And we have several challenges which is facing health department, i.e. from management and running of the health sector. Do you know, I want you to highlight some of the challenges which affect mostly the operation and the management of the health sector as a whole. Number two, and the solution you think if this committee find it fit to approve you, what is that impact or the solution to those challenges? Second and last, are you aware of, because you are a resident of this great county, are you aware of all the government health facilities in our county? I want you to highlight if you know of any, how many level 1, 2, 3, 4, and 5, if you know of any. Thank you.
Thank you very much. So I want to give you so that you can perhaps give us your thoughts and maybe the responses. But before then, when the governor was opening this assembly during the first sitting, he did mention that there is a proposal to build an oncology center at the Kericho County Referral Hospital. Because of the challenge that we have, as we know that cancer the case has really gone up, and it's a killer disease. Also aware that you come from Chepkirui East, where there have been a proposal, especially in the parts of Londiani, to come up with Londiani Referral Hospital. What are your thoughts on this? Should we continue? Do we do the oncology here, or it should be part of the referral? And whether there is the plan of still establishing a referral is still in place, and it will be based in Londiani, as approved earlier in by the last regime. So, honorable members, you will permit me, she tackles that, and then from there, I'll come to Anita and Ruta and Dominic. Please try to be brief as much as possible. Thanks.
Thank you, Chair, and the team as a whole. Okay, I think I'll take the questions as they came. The first one are the challenges affecting the health sector and how I plan to resolve them. Through the Chair, I've been also working in the same system since devolution. Health sector had is involved in some challenges. And challenge number one is the human resource, which is the main factor in health service, is demoralized. That is number one. We have a workforce which is demoralized. And the demoralization is coming in several ways, not one way. One, a good example of Kericho, we have staff who are on contract, we have staff who are now on permanent and pensionable. The same staff are supposed to offer the same service. You will find that the ones on contract will not be willing to give it all, while their counterparts who are earning who are earning a bigger salary, they are serving the same service. So at that point, these staff, there will be some kind of friction. And how to arrest the situation is to strike a deal with the unions on how now to, because I know already as we talk, there's a budget for 2022, 2023, though we are almost finishing the second, we are in the second quarter. So we need to go and have a dialogue with the unions and we strike a deal. We confirm these people in stages, because it will not be possible to observe all of them at once on permanent and pensionable. Because as you realize that most of the health, though I'll now touch, there is another question on health budget. In health budget, I've just seen the 2022 budget which was approved. The health budget is around 2.8 million something. Now, in that budget, one it's 2.6 actually billion. But in that budget, 1.8 billion is on salaries, the recurrent years. So you find that it is actually taking a huge sum of money on the human resource part of it. So we need to structure it so that we need to show our staff also that we are doing something for them. We don't leave them to be there just waiting who will come and save them. If given this position as the CEC Health, I would want to engage with all the stakeholders. One, the unions are our stakeholders because in an event that we don't agree with our staff, they normally go for these strikes. But once we have a striking balance with the unions, we will have a memorandum of understanding, and it will solve also most of our problems, because when you are doing a memorandum of understanding with these people, as we are planning to put your people on permanent and pensionable, and also to employ more staff, why can't you also be there to give a service to this mwananchi? Because when you go out there not giving a service, and the mwananchi is suffering, and in our code of ethics, we are supposed to be offering a service, not seeing the remuneration. The remuneration should not come first. So number one is to engage with the stakeholders, and also the health budget is small as compared to what it's supposed to take. So there comes in now another thing, we need to go for an extra mile to lobby for funds from donors so that we can equip our facilities. It can assist us equip our facilities. It can assist us also to do more of structures and infrastructure in our facilities so that whatever the county is offering will go mainly maybe to paying for the recurrent and the buying of the drugs. Another challenge of the motivating factor for the staff morale, we find that in any system, sometimes you find other senior officers are being supervised by their juniors at the service delivery service. A good example could be maybe you find a senior nurse is offering a service in a facility while the in charge of the facility is junior. Those also sometimes they do, not unless there is a special request for such a nurse not to. So at management level, we need to note those things so that we don't demoralize our staff while thinking we are really supporting them. That is another point on the staff demoralization. Another point, as a county also, we need to ensure all our facilities are well equipped. We have the supplies. We have the commodities required. Because for a nurse, I can take an example of a nurse. A nurse at no point will handle a patient without gloves. So in an event whereby we don't provide these people with these commodities, there will be no service. And those are the main challenges that is affecting most of our public health facilities, not only Kericho, but now we are zeroing into Kericho, which now, it's now at the policy level that we need to come up with proper priorities. As we are planning for our budgets, we need also to do proper prioritization of our budgets and implementation as well. Because sometimes we do the planning, prioritizing, but the implementation bit also is missing. So as we move ahead in planning and also going out of our way to the partners to support us, we need to implement what we've really planned. The next question was, what do you have to enhance the revenue?
Yeah, and the Edna, let's speed up in a summarized manner.
Okay,
Where
thank
we,
you.
where honorable members, where you will feel that you will only need clarification,
I do.
we can, of course, seek clarification from you here.
Okay.
All right, thank you.
Thank you, Chair. Now, on the issue of revenue, one, we do digitization. Digitization we do from all the way from the inception up to the end product. What I mean by digitization is, as the patients come in, we need to capture their records well, and also what they are going through, so that in an event that, because I know where we are the main source of revenue in a health facility is through drugs, because that is the main source of revenue, and maybe some medical diagnosis. So the main thing that will assist us there is digitization. We digitize and also have CCTV cameras which are working in our facilities, so that we capture to see where our leakages are. On the issue of the chain of command, in terms of me being a public health officer, now coming in as a CEC Health, and we have doctors. Personally, and even I know of many places whereby even nurses are being CECs, public health are being CECs. In some counties, one of the counties has been Isholo. Currently, the CEC for Nandi, who was there in the other term, and this term is a nurse. So in health, we have 17 cadres. And among these 17 cadres, when it comes to the supervisory role, not the service role, anybody can be a supervisor as long as you have what it takes to be at the managerial level. Thank you. Chair, on the political, I think that is the Honorable Chair from Mainamoi. You asked about I shun away from the politics. Chair, it wasn't really that I shun away from the politics from maybe the hate or anything. When the issue of resigning came in, I just thought of the people who are still depending on me, and I thought, supposing I don't get, and I still have these people, I said, no, I'm not taking it. So it wasn't that I was afraid, no. I didn't want to lose that, what I had at that time, because of the people, they are depending on me. On the issue of casuals on contracts, I think I've explained a bit of it. Or now we are planning to observe them. We'll have a plan to put them in phases, because sincerely speaking, the budget we have will not accommodate to take all of them. But we'll have a negotiation, and through this house, if approved, I know if you can increase the budget for health, it is also my wish that these people get that salary, because they have also dependents who are depending on them. Drugs in our facilities, if we use the same digitization method, because now we have a lot of leakages, whereby if we cannot really tell how our drugs, we need to be monitoring. Because in a click of, nowadays we have technology, and it is good to embrace technology. A very good example, in MTRH, they are using the same digital, and it's a public facility. Even us here in Kericho, we can employ the same, and at source, where our suppliers are bringing our drugs to Kericho, we can do coding. Say that in case of any leakages to any of the facilities around, or we suspect there are fishy things happening there, we can always track because they are coded.
Chairman, on that note, Chairman,
Yes, Honorable Chair.
you know, in the previous regime, the county government used to pick drugs from the chemists that we have around. In the previous regime, that is the last 5 years, the county government had an arrangement where when there is no drugs in the facility, they just go to a chemist and they pick drugs in those chemists. You know, such an arrangement, you can never prove evidence that such drugs were supplied. I can tell you there was a lot of interest.
The Honorable Chepkirui, when you say pick, you need to clarify and so that we can know. When you say picking, the county government used to go and pick.
What happens to be chair, Paul?
So for the benefit of nominee to understand, because she was not part of, she has not worked before with this county government. Yeah, so
maybe to hit the nail on the head, chair, in the previous regime, I don't know the kind of arrangements the department had. They used to get supplies from the chemists that we have around, and not all the chemists. Some of the chemists belong to members of the county assembly then. So that is how serious it is. As you come into office, how are you going to make sure that we don't have such issues in our facilities? Because we will say this today, tomorrow, and forever. Thank you, Chair.
okay, thank you, the Honorable Chepkirui. Maybe you can make a comment on that as you proceed.
Okay. Thank you, Chair. Okay, maybe on the same, the Honorable Chair, maybe what I can just say for that, I think if there is an integrity issue there, it can be handled at another level. But where I'm seated, I know there is the procurement way of procuring our drugs. So always it's good to stick to that. But in case something like that happens to me, that one cannot be condoned. Where I sit, I can't. Thank you.
Honorable Chepkirui, that is clear, is it? Even in the governor's manifesto, Edna, he has indicated that there will be zero corruption. So we hope that in case you are approved, that should be the way to go. Continue with proceed with the other responses.
Through the chair, I think most of the questions were like there, because there was another question which was coming in the name of challenges again, and I think I've addressed the challenges of health. There's now the shortage of staff, which in my early explanation, I think I captured most of them. The shortage of drugs is now maybe also the digitization will assist, and I think now I want to talk something on strikes. On strikes, before a strike occurs, there is a notice, because strikes don't just happen. Normally, I'm not so certain about the number of days, but it should be around 21 days you are given a notice. So as the top management, it is always good to listen to these people. When you get there is a strike, then it is a wake-up call. Something is not good somewhere. Sit in a round table and agree on these issues. We don't wait until the last day when a strike is about to happen, where you cannot agree, because human beings' nature, we know, all of us. There will be a lot of blackmails, which we can really avoid if we start, when you get a strike notice, you act on it efficiently. I can cite a case of 2016-17 in Uasin Gishu. There was a strike notice which was to happen. The strike notice came, but the strike never happened because the CEC then took a prompt and involved all the unions, and they sat and agreed. And the work went well. So some of these things, sometimes, if we can offer a listening ear to these people, things can work well for all of us. The challenges of management of health and the solutions. The challenges of health and how to manage them In any hierarchy, it starts from bottom going up, as our slogan of the Kenya Kwanza. And that the people who are offering the greatest, and I can say this, are the people who are down there. And they are the people who are also looked so much down upon. Personally, I grew from top, from down, coming up. And I can tell you, I know the challenges which are down there and coming up. The challenges, the people who are down there, they sometimes even only want even to mingle with the big people, the big bosses, only just to feel they are part of the system. But when we disintegrate them, they feel it's like they are in another world and the executive are in another. What I'll come in with is one, we'll be organizing for retreats at the sub-county level, because you cannot bring all the staff to the county, but we'll ensure we have retreats at the sub-county level, whereby we'll involve the sub-county, plus all the in-charges, plus all the other staff at the sub-county level, so that also we don't deny the wananchi a service at the expense of team building or something of the sort. By doing that, we will work as a team, because health need a lot of teamwork. And not only teamwork even from the workforce or the human resource working at the health sector, no. Even the mwananchi at the village level, they need also to be sensitized on what services are we offering. Sometimes our people suffer, they go to private facilities and yet the same service, they can get it at a lower price at our facilities. But it is because they don't know. So in my tenure, if this house will approve me, I'll really want to work from the down coming up, because I know where most of the people are down there. The people who are up here are just a few, and some of the people up here can even afford to go to the bigger facilities. They have the insurances, but the person at the village level, they are really, they are the people we are supposed to take those services to them. Another thing, we'll do more of outreaches. These outreaches will take some of the services close to the mwananchi. And we have our CHVs on the ground. These CHVs do a lot of work. They do a lot of social mob. They can even identify some critical illnesses and advise that person that you are not supposed to go to this facility. Just go direct to this facility and you will get a service. So with more of outreaches and more of health education, our people will get the services and will streamline health. When I come to the oncology center, I know it is in the manifesto of our governor, and we'll realize the dream. How to realize the dream? Currently, there is an isolation center at the district hospital, which will just be a temporary measure, but going forward, we'll source for funds, and we do a standby isolation center, because as a county also, as much as we are now going to utilize another facility, there is also need to create another facility. Kericho current is under the moderate risk areas in terms of critical diseases. We are at the highway. There is Ebola in Uganda.
Chair.
Yes, the Honorable.
On that note, Ms. Edna, as much as we are talking of oncology, cancer center,
Yes.
we also have people who are suffering mental illnesses in our society. People are becoming mad because of depression, economic hard times, they become mad. What is your plan for these people, since we don't have a unit, psychiatric unit in Kericho County, and we have been suffering. We have these people with us, they are our members in society, and we are not taking care of them. What is your plan?
To also add on to that, on emergency services, there has been a great challenge where there is an emergency service that is needed to evacuate maybe a patient from Kericho District Hospital or Kericho Referral Hospital to a higher facility like Moi Referral or Eldoret or Nairobi KNH. Once in a while, you find someone who needs emergency services. He is not communicating, he is under critical care. For example, maybe he's on life support machines. He's supposed to be transferred from our facilities here to either Kenyatta National Hospital or Moi Teaching and Referral Hospital. And you're telling the relatives, yani in short, you're telling the person who needs to be transferred to fuel an ambulance. What will you do if you are approved to be the CEC for help? Because that is an area that we thought we had addressed the challenges of asking a family member to fuel for emergency services. That's number one. Number two, prevention is better than cure. In your presentation, just in summary, would like to hear from you what measures are you going to put in place to address prevention or to prevent diseases before they occur. Thank you.
Thank you so much, Honorable Member. I request that she address that one, and then we be fair. We come to the other members here, and then if there are other supplementary questions, you can we can prosecute that one. Continue, Edna.
Okay, through the chair. I was still on the oncology, and then the issue of Ebola emerged. So I was saying, because whatever we'll utilize as our oncology center at the moment will be the isolation room, which was there during the COVID time. But we are having plans to do we construct the real oncology center, though in a small way, not in a big way, and also include the isolation center, because to me, as a public health officer, from where I've come from, the isolation room is so critical that sometimes you get patients who are supposed to be isolated and you go and expose them to inhuman conditions is not fair. So to me, we will deal with the oncology. At the same time, we'll have the isolation room in place. And the honorable member from Chepsion has also mentioned something on mental illness, which it is so critical as we sit here today. All of us, we know mental illness is real. The issue with mental illness is it has a lot of stigma. And as a county, all of us, we come from this county, we know what it entails. We are not that kind of a community that we are so open. But it is a high time we go out, and as stakeholders, we have a collaboration. As I mentioned earlier, health needs a lot of collaboration from all stakeholders, including the honorable members here. You are our stakeholders. At the same time, you are our ambassadors. So that when you find maybe in your community, because they can easily reach to you, but they don't reach to us, it is always good to identify them first. On what we will do, we need to identify a place, even here in our district hospital, and we offer the service. The good news is we have a psychiatrist specialist in our county. So we are not lacking the human resource we have. So what is there is just to sensitize our community that we are having the service and let them enjoy the service which is there. Because these doctors are just there and they are waiting for patients and patients don't come. So on the issue of emergency service, at one point, I know maybe all of us have gone through the same, either by proxy or as victims. Personally, I've been a victim of such an emergency thing. Anyway. Thank you.
All right, thank you so much.
It's emotional, but okay, I'll just explain.
No problem. Honorable Member, Sergeant at Arms provide water to the nominee. As we also, I think, Honorable Members, health services really in our county, as we all know, is a concern to all of us. As you can see, and you know, I still share the sentiments of the nominee that we have a lot of challenges to deal with as a county government. At this stage in time, I want to give to Honorable Anita. Maybe we continue. You will continue?
Yeah, let me just finish.
You will finish?
I'll finish.
Okay.
Okay.
I want to maybe appreciate the passion that you have for your job and the concern. And I think that the Committee of Appointment, I know when time comes, they will have to make some comments. Continue, proceed.
Okay, thank you, Chair. When we talk about an emergency service, it has to be really an emergency service. And I know we don't have that. Just to be sincere and say, sometimes there's no point to lie when it is not there, it is not there. Because we've lost people through such instances, many people, including I lost my own brother last year. It's hardly 1 year through the same. Now, what I have for emergency service is number one. We have the ambulances. 12 of them. We are not supposed to be suffering. What we need to do is just to empower the referral system in emergency. What do I mean by the referral system? A referral system, we need to have a functional ambulance with oxygen, with nurse, and in terms of fuel, because these vehicles have to move from one point to another, we will separate the fuel that is consumed by the other utility vehicles at the department from the fuel that is used by the ambulances. So that at one point, I would rather use my own vehicle as a CC when there is no fuel, rather than there is no fuel for that ambulance. Because I think even some of the things God will charge us actually on this. So that one, I'm taking it passionately, and I'll do it.
Yeah.
In terms of, Chair, let me finish on prevention. That is also my area. In terms of prevention, we have the UHC. In UHC, we have people who are supposed to assist us. They are the community health volunteers. Our community health volunteers are not paid anything, but they only get stipends maybe when a partner come in and there's a program running under that partner. That is when they get a stipend. But going forward, we'll engage with all the stakeholders, including you, honorable members. I know there is a committee for health on the same, so that we see where these are critical people that they are assisting us, and they also have a living to live. Most of our diseases in our facilities are prevented. If they can be addressed at that level, we'll reduce the burden at the facility level. So one, we have public health officers who are outside there. They need to be conducting they need to be doing the normal routines of checking our markets. They need to be visiting, maybe like now, for example, you are in a place like Ainamoi. The facility which is there needs to be capturing most, because now the public health officers knows the people who are living in that catchment area, so that even as we take the services to the wananchi there, we know what are the illnesses which are more common in such an area, because there are areas where we have malaria. Part of that is Soin, Ainamoi are the areas which are prone to malaria. So as they are doing that, we need to be having like even our commodities for malaria to be more in those areas than in the other sites. So when we use these people to do the RTDs, when they go to the homes, they need to, the use of nets and such, when they do the real health education as we used to do, most of these diseases we can, and they also need to be supported like motorbikes, and motorbikes consume little fuel. It will not be abandoned to the county. So we'll move to from more of from curative to preventive, so that even we save on the issue of drugs.
Chairman, now that you mentioned Ainamoi, can I say something? Just in a second, Chair. Okay. Thank you, Madam. You've mentioned Ainamoi and Soin. You know, in Ainamoi, we are the only sub-county that has no sub-county hospital. Ainamoi sub-county has no sub-county hospital. The sub-county hospital is now the Ainamoi Health Center that we have tried our best in the last regime. We built a state-of-the-art theater, but it is not operational. We've provided funds for buying the equipments, but nothing has taken place. So please, if you are given the chance, elevate the Ainamoi Health Center to be a sub-county hospital, and that facility will decongest the county referral hospital. If you do that, God will assist all of us.
Thank you. Thank you so much, Honorable Cheriat. I want to give to Honorable Anita, and then Anthony Ruto, and then the Honorable Dominic, and then you will take from there, all of them. Okay.
Thank you, Chair. Honorable Edna, thank you for taking time to actually share your heart with us concerning health. I think my question will touch on the mothers, the maternal healthcare system. Apparently, I remember recently there was a time our governor visited Kericho District Hospital, and he was shocked to see mothers sharing beds in just the nearby hospital here. I think my question would be, you know, as part, I know we still have challenges with the devolved system, and part of the challenges would be the realization of rights to health. And we lose mothers every other day. Just coming in as head of health department, health sector, what are some of the measures that you would put in place to see that we don't lose mothers along the way as they wait for services that are yet to be attended across the villages, especially. Sometimes when they're not able to maybe go all the way to come all the way to Kericho from the villages. What are some of the ways that you would put in place to ensure that our dispensaries can really handle the issues? Because I know back in the wards, the health centers are the ones who actually help our mothers. Otherwise, you have to travel all the way to Kapkatet or come all the way to Kericho. What are some of the things that you would do differently so that we reduce this number of cases that we lose mothers while they're giving birth? Also, I think I'll add on maybe further clarification on procurement process. I know we struggle throughout the year to provide drugs at the hospitals, and with the autonomy of procurement processes that the county has, possibly or maybe that's where we have the challenges. I don't know what you're thinking of when we talk about the procurement processes that we can use, or maybe look at ways that we can benefit from the economies of scale, maybe across, across the country, to be able to actually find ways that we can get consistent supply of medicine to our hospitals. Maybe just share something on that challenge that is out there about availability of medicines and maybe even equipment. Just to mention that you have to be aware of the fact that there is a heavy political influence in the procurement of these supplies and equipment, which is very common. I think we realize what happens with KEMSA. I don't know what you can say on the same as we work to ensure that we provide services to our people in Kericho County. Thank you.
Yes, the Honorable Anthony Luther.
Thank you, Chairman. Edna, one of the key roles of a public health officer is management of solid wastes. This one is a major challenge in most of our urban centers. A case in point is Kericho Town. Kericho Town used to be one of the cleanest urban centers in Kenya before the inception of devolved units. As we are speaking now, Kericho Town is full of solid wastes. Up to Nyagacho. And it is not only Kericho Town. Go to Chepkirui, go to Litay. Edna, if in any case you are given this work or this responsibility for being a CEC, what mechanism are you going to put in place to see to it that our urban centers are free from solid wastes? Another question. Another question. In our wards, we have new facilities which were constructed and they are completed. Unfortunately, they have not been opened because of lack of personnel. Madam, what are you going to do to see to it that these facilities are given personnel. And as you are preparing to do that, we have an element of wage bill in the county. How will you be able to balance the two? Human resource management and development is key as far as provision of quality services is concerned. When I was perusing through your documents, I was able to see a certificate which you were given by attending a strategic human resource management and development course in Kenya School of Government, Matuga. How will you be able to apply the same in Kericho County to enhance human resource management and development? Thank you, Chairman.
Yes, Honorable Dominic.
Thank you, Chair. Karibu sana, Madam. I'll be very brief. Health sector is a key health sector. It is a service delivery. But for the last 10 years, our hospital has been in autopilot. Most of the hospital, and especially in the ward level, the dispensaries are there. It has been built, it has been opened, but the personnel, when they are on leave, there is no reliever. If it is a maternity leave, plus the leave, which is a normal for every human being, there is no relievers. Patient will go to the hospital, the drug will expire. Touched on issue of operationalization of the maternity at the level 1 and level 2 hospital back in our villages. Our wife and mothers have to travel all a long way to the referral hospital and some sub-county level. And for your information, Belgood sub-county does not have also a sub-county hospital. What we have at Sosio is just an hospital, I don't know which is level 1 or level 2, but even the theater is not there and the facility. What are you going to do so that the same hospital will work at sub-county level and reduce the patient which will come to the referral hospital here? Otherwise, thank you.
Yeah, thank you very much. There is one from the Honorable Majority here. Then you can respond.
Thank you very much, Chair. I have a couple of questions, short questions, but beginning with resources that are owned by hospitals within the county. Number one, for example, Londiani Hospital has a total of 75 acres of land, which only less than 10 acres is utilized. And there is also another allocation of 100 acres of land, which has been set aside for future referral hospital. Now, my question is, the total of 175 acres, which can be utilized well by the county for proper use in terms of healthcare provision. If you are today appointed as the the CEC of Health, what plans do you have in such a regard? Number two, I want to give you a scenario. A patient calls you from a hospital reporting that they have a relative who has been admitted for more than a week, no attendance, no drugs, and the cost of admission is going up. What will you do as a CEC? Number two scenario, a voter from Londiani calls you from a dispensary, reporting that they have been going to the hospital, to the dispensary, for close to 3 days or 4 days, and they have not received any service. What will you do? Thank you very much.
Thank you very much.
Then Chair, a brief one, just an SMS. Edna, you know, somebody, it's live, eh? Somebody has just sent me a text for you to confirm. I'm told you're born in Chepkirui East, Kidawa. You're married in Belgut, but you live in Eldoret. Now that we are vetting you here, should you get this job, unaishi wapi sasa?
Okay, thank you very much, Honorable Ogon. Edna, maybe you can take those ones. And then
So
let's also
I can start with the last one.
Yeah, and
Yes.
requesting you to be
Yes.
brief because
Yeah.
we still have other nominees too. But
Thank you, Chair. Yes, I stated very well. I was born in Kadawa. I said I'm married, and I'm also working in Wasingishu, and I'm owning properties everywhere. I think sometimes where you stay doesn't really matter. I'm from Kericho County. I'm so proud to be part of Kericho, and I want to give a service to my people here at home.
that is okay. I think that is well answered, Honorable Ogon. Now you can proceed with the other responses.
Okay, let me respond to the chair, to the question from Honorable Chair from Chemasot, Honorable Anita. The concerns of our mothers is really a challenge. I know on several occasions, sometimes we really lose mothers when they are giving birth, which at this era, it's not supposed to be happening. The plans I have for this is, one, we have 7 hospitals, in the ones we call hospitals. We have 11 health centers and 155 dispensaries. At the level of a dispensary, you can have 1 or 2 beds for mothers to deliver. So when I come in, if this house will approve me, we need the 155 dispensaries have to be functional because they will take the bigger lot of our clients so that we decongest the 9 and the 7, because if all our mothers are coming to the health centers and the hospitals to deliver, actually we'll have a challenge. So we need to operationalize the maternities in our dispensaries. And also on the same, the Linda Mama initiative is there for our mothers who have NHIF. And they pay for all the services from antenatal to postnatal. So for our mothers who have the NHIF and they are attending, it is also another source of our revenue to our facilities. So as we equip our dispensaries and create that service, it will also be an increase to our revenue to our facilities. On the issue of procurement, I can't talk much on procurement because I'm not a professional on that line, but what I know if we do our planning early, and we know we check our stocks regularly, and we monitor our systems, as I had earlier alluded that we need to digitize. Because in our system, every other time when you sit as a CEC, as a chief officer, or even as a director, you know what we still have in our stock, and even the pharmacist. We know what we still have and how are our commodities moving out. It will be so easy as their stocks are moving, you are in the process of planning to procure more. But in a system whereby you wait until you have exhausted everything, there's an outcry, that will be an issue of firefighting, and firefighting will not sustain it. So the plan should be, we need to have a proper plan and implement the plan. On the issue of solid waste management, I am a public health officer, and the public health officers out there are in charge. Though the role of solid waste management has been shifted to the environment department, but what is there for the public health officers is to enforce the law. So as a department, we will come and work in conjunction with the Department of Environment to ensure that our towns are clean, our villages are clean, everywhere is clean, because a clean environment is equally free from diseases. That is one way of even minimizing some of the diarrheal diseases, which I got to know that it is one of the top 10 diseases in Kericho County. Malaria also is among the top 10, and one way of malaria getting to us is maybe when the mosquitoes breed on wastes. So by doing that, we'll have reduced the burden in the facilities. There is the issue of HR. There is need to do reorganization. And how to do reorganization, I'll have to do a situational analysis of how our facilities are. Because I have not been in those facilities, but it can take just 1 or 2 weeks to do a situational analysis, whereby you get to get the services running in a facility versus the number of staff, and you do a comparison, because I am aware there are facilities that you find maybe we have like 3 nurses. It's a dispensary, you get one, there's another one with 1 nurse. So we need to compare with the workload, so that as we even reorganize our human resource, all the human resource should feel that they are offering a service, not others being burdened and others are less burdened. We need to work in a collaboration, and we enjoy our work. On the issue of the Londiani issue, on the issue of the Shamba, I don't think I'll be able to give an answer at the moment on that, because...
Oh, sorry, yes, Honorable.
There was a question also that I posed to you through the chair.
Yes.
There was a question I posed to you, Edna, on new health facilities that have not been
Yeah, actually I had written in the next page, I was moving there.
Okay,
Yeah.
proceed then.
On the issue of the facilities which have been constructed and they have not yet been opened, that will be part of the reorganization we are going to do, because once we reorganize the existing ones, we'll have staff, because a resource was used to build that facility, and there was need for the facility to be built. At the end of the day, all our citizens should enjoy this facility. So with the staff that we have, we'll do a reorganization and ensure we get a service to all our people.
Through the chair, I'm not satisfied with the question on the proposed referral and the land use in Londiani.
Yes, Nominee, Edna, please, maybe you can still clarify on, I had also asked on the same about Londiani Referral Hospital.
Okay.
And I'm also keen now that you are a nominee from, you said you were born and brought up in Chepkirui East.
Okay.
And we have been waiting for this referral for the last 10 years. Maybe you will talk about it, and then you will also try to address the issue of land as raised by the Honorable Majority, please.
Okay. Through the chair, the information that I have about the referral that was to be built in Londiani is they are done up to the plans, there were drawings. The plans had been done up to the finish level, and then I think the politics came in and it stopped. That is why I said I didn't want to comment so much about it, because I don't have much about it. But now, because I'm coming in as the CC, I'll revisit. And because we have a committee on health, I think we'll follow it up as a team. Secondly,
on the same. On you know, the matter of referral hospital is very dear to those residents that comes from Chepkirui. We hope and believe that given a chance, you will push and ensure that that referral hospital is built in Londiani. That is really the concern of so many. We are getting a lot of messages that people, please, as we pray that you be approved, and when you are approved, please remember that the people, the great people of Chepkirui, are asking that their rights. They're asking for their right, and that right is Londiani Referral Hospital be built there. And also as an advisor to the governor. Those are the sentiments from the ground. Maybe that's what I'll say that. Now you can try to respond to the issue of land.
Okay.
And the one for Ainamoi Sub-County Hospital. I think you'll address it.
Through the chair, let me finish on the issue of Londiani. The Honorable Chair from Londiani has also talked of there's a lot of land. The land can also be, I think, Chepkirui East, Chepkirui West are the only, we don't have any institution on matters health. It can also be an opportunity, we open up a medical training center in those sites. That is a thing we can sit and look, and we also source for partners, because I know when you do a good proposal and convince the partners to come and do it for you, they will surely come in, and they will incorporate the referral hospital with it. Thank you. On the issue of Ainamoi.
So give an undertaking that when you become the CC, you will also push for the same. If this committee find it fit that you are nominated as the CEC Health, give an undertaking to this committee that you will push for the same, and you will advise the governor accordingly.
Okay. I'll do it, because one, acquisition of land in Kenya is an hectic and tedious process. We already have the land. What we need is just the funds to kick off, and we already have the plans. So I'll do it.
Thank you. Proceed with the other response.
On the issue of Ainamoi, the honorable member from Ainamoi, if you approve me in this committee and I go to that office, I'll surely ensure that you have a sub-county in your sub-county. Thank you.
Other members, which support the honorable are you talking about?
Thank you, Chair. You know, the nominee Edna has just told me that if she gets an opportunity to serve as the county head of health services, she's going to make sure that Inamoi Health Center will be elevated to a sub-county hospital. And I was just informing her that he has my unwavering support in making sure that that facility is elevated, you know.
I think the honorable member has clarified the kind of support. Please finalize.
Chairman,
yes.
A very tough question. We are told, and let me not be very sure, that there are cartels, very heavy cartels in the Department of Health. Should you be approved, how will you deal with these cartels? How will you deal with them? Because we are told they are entrenched in the system. They run from up down to the lower level, to the lower administrative level of the health department, and they are all over. There was that's number two. Number two, there was a case in Kapkatet where a patient was pronounced dead, in quotes, taken to the mortuary. As the mortician was cutting to apply formalin, the mortician realized that the dead patient was not dead. Very quickly, she made a phone call and the department went for the dead, and I'm saying in quotes. And he was taken back to the ward, attended to, stitched to the part that had been cut, and the patient lived for a few months. Now, that was a very serious case in Kapkatet. If approved, what will you do to make sure that such a case does not happen again? Third and the last one. We have patients once in a while, they are treated in hospital, and when they are due for discharge, they are unable to meet their medical bills. They are detained. And once they are detained, there is a meeting, I'm told, every Thursday, where the Department of Health has a meeting to identify those who are unable to pay, and they are discharged on a Thursday on advice by the Department of Social Work. When you detain these patients, you detain them at a cost. What will you do if you're approved as a CEC to make sure that much as you need to treat them, you also do not have to detain them? Because when you detain them, that's a cost. And the mental health element comes in, because when you have treated me and you have discharged me, if I'm unable to go, then you're also torturing me because I am forced to stay where I'm not supposed to be staying. Thank you.
Okay, through the chair, maybe to just mention something on Ainamoi again. I listed it was one of my facilities that I got some good training there when I was doing my degree, and I went to a place we were doing something on Jiga. So it is still very fresh in my mind. Okay, thank you. Jigas, yeah.
Yeah, well,
Yeah, the lower side, yes.
Yes.
Yeah, yeah.
Order. Order honorable members. But the nominee was at Ainamoi sub county or the health facility. So proceed.
Okay, through the chair, sorry for that. Okay, the issue of Kapkatet, that is really sorry and pathetic, but it's a case of negligence. And in any case of negligence, when proved beyond reasonable doubt, and the law is so clear on how to deal with such a person. But to stop such happening, sometimes these people, they don't do these things willingly. It could be out of exhaustion, and it will still take us back to where we were on the issue of we need to do a reorganization of our staff so that we don't overburden others. Because sometimes you get even to a facility, and I can take an example. When we were doing our support supervision, you get to a facility, you can easily tell this one has already a burnout. So to avoid such scenarios and so that our clients can get good treatment and they get dignified services, we need to do a total reorganization. There is need to do that. And on the same, it will also affect the cartels. Because the cartels...
Chairman, we really would want to hear, because there have been several stories. You know, when we talk about these cartels, sometimes we were told the other day that the governor flagged off lorries carrying drugs to all the facilities in Kericho. Immediately after flagging off the drugs, some patients were being told to go and buy drugs again. Now you wonder which drugs was the governor flagging off, and which drugs this was being asked the patients to go and buy again. That's why we want to hear explicit explanation on what you will do to address these cartels.
Okay, Edna, maybe you can respond to that. I think that is there's been a huge public outcry on the same, and as you respond also to that, there is also the question of patients. I don't know whether it's true. You'll find out, as in Kericho County health facilities charge higher costs for the patients. So that is also something that has been a concern to so many citizens. And again, it is still attributed to cartels. And we are also told, I know you have now moved to cashless, but we are even also informed, we don't know whether it's true, that even as we have moved to cashless and even before, there is still also an allegation that some pay and others don't pay. There is the concept of the animal farm when it comes to payment of these bills. So maybe you can also comment on that, because I think that is all about cartels.
Okay.
Thank you.
Thank you, Chair. On the issue of, okay, I don't want to use the term, but in an event whereby you find things are not running the way it's supposed to be running, people might be, those are integrity issues. What is there is, we have the procurement people, we have the pharmacists, because I think the whole issue here is mostly affecting drugs. And that is why I came up with the issue of the coded drugs. Because with coding, in case our drugs leak into the market, our stakeholders, number one, are our clients, who are the public. If you go buy a drug and you find together it has a code of Kericho District Hospital or county government of Kericho, how? So the code, it will not be a thing of tomorrow, but I can assure this panel through the chair, we cannot allow our people to suffer. As much as the funds that we are getting is not enough, but let that fund which is there surely serve that mwananchi as is required. We get salaries, we are paid for a service. So as a CEC who is paid a salary to oversee all the procedures, I'll be one of the people who will be in the communities down there. And I thank God most of the people don't know me. So even if I go and become a patient, nobody will surely know this is our CEC.
Chair.
It will.
You want to say something?
I wanted to ask, I'm concerned about that coded of drugs, because that is the main major issue in our hospital. The drugs are currently coded GOK, but you still find its way outside the hospital. Our sisters and our brothers are working in that hospital, and mainly from the Kericho County. What are the best strategy? Because the governor will continue flocking the medicine at the referral hospital, but after 1 week or 2 days, you go to a hospital, you will not find the medicine. That is the main undoing we have in our dispensaries and mainly in our hospital.
Yes, thank you very much, Honorable Dominic. I think she was trying to maybe to explain it. So maybe, Edna, it's just about the question of control. Yeah, so
yes.
as you respond now, Anita, you want to say something?
Yes, through the chair. Just, I think, to add on what Honorable Dominic has talked about, I think it's high time, Madam Edna, that we really come up with measures of that we're able to actually control the stock. Because I remember there was a time, I think some months ago, that there was a huge outcry on social media of a car that was seen leaving Cap Cadet Hospital with the medicine in boxes. And I know it was followed through, and I don't know what the solutions were. But I still feel personally that we don't have a good way of actually managing or controlling the medicine that goes out to dispensaries, to the health centers, and from the main, the main hospital that actually distributes all this. So maybe as you respond to that, let us look for a long-term solution. How are we able to really pull through when it comes to what we are buying and what is getting to the patients and what they are buying from those chemists? Because it's unfortunate that you go to a hospital, you're told there are no drugs, but out there's a chemist that has what you need. And what is out there is that most of these chemists are owned by the same people who work, and they'll actually tell you which chemist to go and buy. So let us try to find possible solution on the same. And maybe just to add on so that I don't come back, is the issue of public-private partnerships that I know if you sit down when you get this position to head the health department and work on, I know there was a PPP act sometimes back that was passed sometimes back. And if you can actually capitalize on that as a county, for sure we will be able to achieve most of the things or the challenges that we are facing in terms of structures, in terms of equipment, because you're able to engage the private and the public sector on the same. Thank you.
Thank you. Edna, I will give you roughly around 5 minutes to respond to that. And maybe the last one, and this is the last. As per the governor's address to this assembly, he had promised to place the Kericho residents on an NHI cover, which will be funded by the county government. I don't know what the modalities will be and how this will be done. Perhaps that is something that is very important and pertinent to the residents. So please, just to summarize in 5 minutes.
Thank you, Chair. Okay, on the same issue of how to control our stocks from going out of our facilities to to be sold in the market, as the Honorable from Kapsuit has talked of the cartels, I would tell this House today, they say even for the 40th day will always come. And what I know is when the will is there, surely an answer will be there. Because at the management and with the help, because the health is collaborated with all of us. All of us, we are stakeholders. We will work as a team and not work as a person. We are working as a team. We come up with policies that will enshrine on how we are going to move forward as Kericho County in terms of service delivery. Because surely it is not right for the medicine that is meant to be given to the mwananchi at the facility to be sold. That is it's wrong. And that is stealing. There is no better word to use. So I'll still talk of the same when we do digitization, because MTRH is actually doing it, and maybe we will go and pick best practice from what MTRH is doing as a model, and we come and do it in Kericho County. Because MTRH is a big facility, but you'll never hear drugs being stolen. In our small facilities whereby we can easily control, they are escaping our hands. With commitment, I know all things are possible.
Thank you. Honorable members, any final word to the nominee? Honorable Dominic.
Thank you. Wish you all the best.
Thank you. The Honorable Anthony Ruta.
Edna, thank you for taking time to deliberate on several issues together. Let me wish you the best.
Honorable Anita.
Thank you, Madam Edna. Wish you all the best.
The Honorable Majority.
Thank you, Edna. I also wish you the best. Thank you.
The Honorable Rogon.
Edna, you've done well. I can only give you two things. One, it's a challenge to you should you be approved by this panel. Consider those sub-counties that still do not have personnel to do specialized treatment, like fractures. People still come from Kunyak to Kericho. Lastly, you should also have in mind, should you go through, that those dispensaries need to be operationalized by getting quarterly allocation from the budgets. Thank you.
Yes, the Honorable Paul Chichis.
Thank you very much, Chairman. My parting shot is that should you be considered for this position, look at remuneration on the employees in the Department of Health. If an employee has served for a certain duration, one is expected to be in a certain job group. So you sometimes find an employee for example, if we are two nurses or two doctors or two public health officers, me, for example, myself and Rogon, you may find Rogon is in two job groups higher than me, while I am at the lower job group, and yet we're employed together, we have the same qualifications, we've served for the same duration. So look at those anomalies, be an equal employer. So the Department of Human Resource, in consultation with County Public Service Board, should find a way of doing all that, addressing all those challenges. Thank you. Wish you the best.
Thank you. Thank you. Honorable Merchant.
Thank you, Chair. Edna, should you be considered? I'm proposing that you put up a private wing or amenity for some of our members here are covered. It's a source of revenue also. Otherwise, wishing you the best.
Edna, any comments or anything, any word to the committee?
Okay, through the chair, I don't have any other comments, but to thank this panel. We've really had an interactive session. Thank you, and I hope you'll consider my candidature.
Thank you so much, Edna. One thing that I will tell you is that you realize that health matters sometimes also are very emotive, and that is why some of us were a bit emotional while you were trying to prosecute these matters. Should you be approved, I'm reminded to remind you that history will judge us harshly if we don't build the referral hospital in London. Having said that, I want to wish you the very best, and God bless you. From here, there is tea for the nominee, and probably also we can talk to our clerks so that they can arrange dinner for you. Sergeant at Arms, please escort the nominee. Thank you so much. Honorable members, we are just breaking for 10 minutes, only 10 minutes. So the next nominee should be ready. Yes. Yes.